Hello everyone, welcome to lesson 10 of the medical organizations course. And today we are going to be looking at long-term care. Okay, and there's relatively so much actually that fits into this category, and this is quite a long lesson, but at the same time, a lot of what we're going to be running through are just services, different types of services. So I will actually speed this up kind of a little bit, and I promise this is the last huge chapter, so I'm really going to try not to make this two parts like I ended up doing for the last couple lessons. I'm going to try to keep it all in one, and hopefully that we can get this done in a relatively reasonable amount of time. And then after here on out, the lessons are going to be quite quick. So let's move forward. Let's do this. All right, so introduction, long-term care or LTC. That's what this is. All right, long-term care. It's not defined, or it's not confined to just the elderly. Okay, so 37% of the people who are long-term care patients are older adults, are over the age of 65. Everyone else, not necessarily. So not necessarily everyone else, and so everyone else who is a long-term care patient, usually they might have like a disability or something like that, okay, or some sort of chronic illness. Anyway, so there's a growing non-white older adult population, and that the non-white older population is actually much more poor in health. They have they're a little bit worse off health-wise, and they have a much higher, they're more likely to need long-term care services when they start to get older. In addition, this group is also the poorest, okay, more economically disadvantaged as well. So about 70% of older Americans will eventually need long-term care services, and most of the people will be getting long-term care services in their homes. And another reason for this is because, like I said, many of the growing older population, many of them are actually more economically disadvantaged, and of the people who are going to be needing a lot of these long-term care services are going to be of a non-white group, and they are going to be more economically disadvantaged. So most of them will be using Medicaid services, older Americans grant services, and a lot of community and home-based type services. Okay, so they're not really going to use too many like institution-based or like private fancy institution-based. Okay, many of their services are going to be done in a community or at home. Okay, just because they require to use like the different services that Medicaid will pay for, and that are paid for by government grants. Okay, so long-term care is associated with functional deficits that can be caused by multiple chronic conditions, serious illness or injury, and also cognitive impairments. Okay, so it's not necessarily just getting old and having all these chronic conditions. It can also be as a result of a serious injury or any kind of cognitive impairments, and maybe you have an intellectual disability, and and as a result you need long-term care services. Okay, so remember the ADLs and IADLs? Remember those guys? Well, this is where we sort of determine whether or not you require long-term care services, or which type of long-term care services you do require. We'll use the instrument, so they'll use the activities of daily living, or the instrumental activities of daily living. Okay, so Anyway, there is an estimated 22% of older adult Americans that are going to be needing long-term care services, or that need long-term care services currently. And this number is supposed to rise. We're supposed, I think this year, we should be hitting 25% of our older Americans that require long-term care services. Okay. 15.4% of the people using long-term care services are living in nursing homes. Okay. And 2/3 of the total long-term care service, 2/3 of total of all the long-term care spending is being paid by Medicaid. Okay, so a lot of the services that are provided for older adults, and also not necessarily older adults, but just those who need long-term care services, are being paid for by Medicaid. Okay, so a lot of the burden falls on the taxpayers, of course, and it may or may not be sustainable in the future. Okay. So, the nature of long-term care. So long-term care is so multidimensional. There's so many different services that are, long-term care services. There are so many individualized services that are really more customized to the patient. Long-term care typically they'll use well-coordinated total care all over the place. Long-term care itself, however, is not, you cannot actually call it medical care. Okay, it's not really, it's not the same as medicine. It's almost a different type of care itself. It should be put in a totally different category. Okay, although you do get patient to practitioner, a lot of one-on-one time with your patient and practitioner, but many times it's not just medical care. Okay, that fits into long-term care. It's a wide spectrum of different types of services that are meant to help individuals function, function in their everyday lives. So that is why long-term care, really the objective of long-term care is to maintain function, or to help the patient, just maintain their function, okay? Whatever they're able to do, let's try to get them to be able to, hold on to that and to be able to do those activities in their daily life as long as possible. Okay, so some other different parts of long-term care. We got hospice care. Long-term care definitely likes to focus on the quality of life of the individual and uses the latest advances in technology, and everything that is used in most long-term care services is going to be evidence-based practices. Okay, we don't experiment on our patients. It's just we'll use those practices that have been proven to help. So the goals, like I said, are to maintain function in the individual and to prevent further decline. Okay, so in this case, we want to help whoever you're working with your long-term care patient. You want to help and make sure that that we can try to maintain whatever function, whatever they're able to do. We want to make sure they can do that for as long as possible. So if they can't do certain things, that's fine, you help them, but whatever they can do, you have to let that person do that as much as possible, okay, so that they can maintain that function. So then there's holistic care. Holistic care, we've kind of touched on this in the beginning of the course, where we realized that holistic care encompasses the physical, mental, social, and spiritual needs of the patient. Okay, so it's not just let's fix their physical symptoms, it's let's pay attention to everything that makes their body or their health whole. Okay, so you want to, in long-term care, there are other different types of services that help the individual in all these other areas, not just their physical symptoms. Okay, then we have the quality of life, and it is very significant because as long-term care patients, typically they'll feel like a loss of self-worth when they're and they have to have long-term care services, especially if they used to have full function. Okay, and then suddenly they have less functionality in their life and they can't do a lot of things and they have to have help. Many people experience a loss of self-worth. Okay, so quality of life is so important, and it's so important to try to help people maintain their function largely for that reason. Okay, like I said, long-term care uses latest advances in technology and, of course, evidence-based practices. Okay, so long-term care services, like I said before, it focuses on a variety of different types of services that are provided to the long-term care patient. So on one side we have all the medical stuff. Okay, medical care, nursing, rehabilitation, stuff like that. So all of that is definitely included in long-term care services. However, that's not it. So we also have mental health services, dementia care, things like that. There are many skilled nursing facilities and psychiatric facility, like institutions out there that provide long-term care services specifically for those who have dementia and Alzheimer's. Okay. So some more long-term care services. We have social support and then preventative and therapeutic type services. Okay, so social support, this is going to be the type of services that help the individual cope with this change in their life. So many older adults, they are going through a change. They're losing some function that they used to always have, in their life, and so they're gonna go through a lot of emotions and have a lot of emotional imbalances and whatnot. So having that social support really helps them with that. Then the preventative and therapeutic long-term care services, of course, the main goal is in their preventative services is to prevent further delay or of institutionalization. I mean, not prevent further delay of institutionalization. You want to prevent or delay institutionalization. You want to not have to go to a home. Push that off as far as you possibly can. Okay, so preventative type services are those that are going to really help you maintain function, and much of that type of service is going to happen in a home-based long-term care service and a community-based long-term care service. Okay, and also there are many therapeutic services that provide nursing care and rehabilitation, therapeutic diets, things like that, and these can be institution-based, but a lot of these can actually be home and community-based as well. Okay, so more information on long-term care services. First of all, we can classify, or we can categorize long-term care services as either formal or informal. Okay, so formal is when you get paid. Okay, that's when you get paid for what you just did, for whatever older adult or whoever you're working with. Informal care, that is when you don't get paid. So why would you do all this care? Well, probably because it's your grandfather. Okay, so usually if it's your friend or your family member, you're probably going to be one of the caregivers for that family member. Maybe it's your grandparent, okay, or anyone else in your family that needs some sort of care, some sort of long-term care. So, and technically informal care is sort of like a dying breed. It's kind of going extinct. A lot of us, it's not really, I guess, very trendy to take care of your grandparents or your parents. So unfortunately, that is kind of like a lot of people, we're seeing less and less of the informal caregivers and more of the formal caregivers. Okay, the ones who actually do the services and get paid. It's their job to take care of you. Okay, and then we have respite care. Okay, so respite care is where this is really not for the long-term care patient. This is for the family members who take care of that patient. Okay, this is to help relieve some of the stress and the burnout in the family member. So there are some respite care services that will allow maybe you to take a break. Okay, they'll come in and they will take care of your grandparent while you are able to go to work or go have fun or go to school or something. And then, then they'll come back, or then you come back and then they leave and all that. So there are some respite care services out there. Also, some respite care services will really just be there to support you morally and help you with your emotional stress. Okay. All right, so community and home-based services. These are the type of services that will be provided either in the patient's home or in like a community center or something, some sort of community event or whatever. And the cool thing about home and community-based type services is that the settings are very less restrictive. You don't have to go to an institution and just follow the rules and sit there and just wait till you're provided service and things like that. It's relaxed. It's like you're in your home and, like a caregiver can come to your home and take care of you in your house, or the nurse can give you your infusion in your home, and so you don't have to get up and you don't have to stress about going to a different place or anything like that. So it's cool, and there are many different services. Another cool thing about community and home-based services is that they are way cheaper. Okay, they're way cheaper. Usually, if they don't have anything to do with medicine, however, Medicare is not going to cover it. But there are many Medicaid programs that might cover certain home and community-based services. So, anyway, community and home-based services are typically there because as a cheaper option, of course, and also to help prevent or delay institutionalization, because of course, we should all know, especially from the inpatient lesson that we just went through, institutionalization is expensive. Okay, when you're an inpatient and you're staying overnight somewhere, it's going to be crazy expensive. So let's try to prevent that from even happening and see if we can take care of you in the house. All right, so some home and community-based services, or that's what we're going to go over right now, sorry. So let's look at housing in home and community-based services. All right, so housing these are going to be non-institutional housing, so you're not going to be in some sort of skilled nursing facility or any kind of hospital or whatever. That's not what this is. This is just housing, okay? And so there may be, in the different types of housing for long-term care services, it may just be housing, okay, just place to live, or it can also, in many places, will offer meals, housekeeping, recreational activities, even transportation. Maybe someone will do your laundry, and they might have some other types of services, to help meet your needs as well, available, but maybe not. Okay, and it really sort of depends on how much money you have and what you actually need and things like that. So housing can be private or public. Okay, what is this thing? All right, so it can be private or public. Remember, public is government. So government housing would be the government pays for that housing. All right, let's move forward. So private housing, very nice upscale retirement centers. Okay, that's what that is. Those are like the nice retirement, apartments or the homes or the mobile homes where they're just really nice. And usually how you get something like that is you will pay your interest fee and then you have a monthly rental, your monthly rental. And the monthly rental is usually really expensive. Okay, but they're usually really nice and really relaxing and a nice serene retirement environment. They make them really nice. And they will typically add in, maybe give you the works, or you can add, other supplemental services to help support you, depending on like what you need or what you want and whatnot. Of course, everything that you add on is going to be more money, but if you can afford it, you can afford it. Okay, and then we got public housing. So public housing is going to be government assisted and government subsidized housing. So we got a couple different ways that this can work. First, there's the HUD program, which is going to be federal aid that's given to local housing agencies, okay, to offer lower rent to qualified low-income people. Okay, then you got a voucher program. So this voucher program can be used. Typically, there are many different like apartment buildings and whatnot that will accept that or have been approved, and so they will be able to accept the vouchers, and the government will just pay them through the voucher program. So you can get vouchers from the government, and then you can use that to choose wherever you want to live. And then there are also public housing operated by the government. So this is where the government actually like owns its these housing structures and whatnot. And this isn't very common, but this exists. Okay, and then we have also federal funds that can be provided to a lot of nonprofit sponsors to construct rental housing. Okay. Okay, so then some more long-term care services. There's end-of-life care. So this is going to be your hospice services. And I think we already kind of know what that is. Okay, so who are the different clients of long-term care? We got older adults, then there are those children and adolescents, then young adults, and then people with HIV or AIDS. So older adults, this is going to be age 65 and older, that group. Okay, those who reach 85 years of age or older is really the fastest growing segment of the population that requires long-term care services. Okay, which is, duh, right? Of course, that would be expected. All right, so then also the demographic trends have serious implications for the financing and delivery of long-term care services. So 20% of the population will be age 65 and older by year 2030. Okay, that's just one decade away, and that's a fifth of our population. They're going to be 65 and older, and the thing is, our older adults now are living much longer, okay, because we have a much longer life expectancy now. Okay, so they are living much longer, and so that means they are going to be on long-term care. They're going to be utilizing long-term care services for a much longer time. So we have a lot of people getting older, a lot of people who are going to be using long-term care services for a really long time. Okay, the question is, when we get into this later on, is can we even sustain this? Are we going to be able to take care of everyone appropriately? Do we have enough resources, and do we have the money? Because a lot of older adults are going to, well, of course, a lot of older adults are going to be on Medicaid and Medicare, okay, dual beneficiaries. So are we going to be able to, is our taxpayer money going to be able to sustain this completely? And that's the question. But anyway, moving forward, older adults who are in the lowest socioeconomic status are at the greatest risk for needing long-term care services. And of course, if that's the case, they're at the greatest risk of needing long-term care services, then they are going to be needing them for a really long time. And that's a large group that is just going to jump into the long-term care system and require a lot of these services. And the thing is, this is the group that requires Medicaid and Medicare, okay? Because typically this group does not have private health insurance or private long-term care insurance that they purchased a while back. And so this particular group is actually going to be dependent on the system, the public system, public health insurance system for their long-term care services. Okay, so then we have children and adolescents. In children and adolescents, when they require long-term care services, it's usually because they have a developmental disability, an intellectual disability, any sort of birth-related disorder, okay? So, and normally we'll have specialized facilities that are actually equipped to care for those who have these type of disabilities, okay? Younger adults. Of course, many young adults have the same thing, as the previous line, right? But also they have lived a little bit longer, and they may have actually experienced, injury. Okay, so it's likely that they could have also experienced injury in addition to having some sort of birth-related defect or intellectual disability or developmental disability, any kind of disability. Okay. Also, in 1999, the Supreme Court ruled in Olmstead versus LC that the states have to provide community-based services for intellectual disabled patients when it's appropriate. So what this really meant was that for those who, the government was basically saying, look, just because adults who have, there are adults with intellectual disabilities, we don't need to keep institutionalizing them, okay? Whatever level of functionality they have, they should be able to allow themselves to be independent so that they can, they can function. And we should just offer community-based services or long-term care services, home-based services and whatnot where it's appropriate. Okay, we don't need to necessarily, restrict them from any kind of, development or any kind of, positive, thing that, from growing or from, experiencing their full potential and whatnot. Because if we're there institutionalize them, we could be holding them back. Okay, so this meant, okay, let's let them live as much of a normal life as possible, and we will offer them community-based services and home-based services where needed. Okay, so there's that. And then we have people who have HIV/AIDS. Now, HIV/AIDS is considered a chronic condition now, not necessarily, it's not acute, it's not subacute, it's not a death sentence either. It's a chronic condition that we maintain thanks to our highly active antiretroviral therapy that is available for these patients. So they can live normal lives and they're all good. All right, but it is a chronic condition now, and it just has to be maintained. You maintain this condition well, and you can be fine. So people with AIDS are subject to a lot of comorbidities because they are very immunocompromised, right? So they are subject to comorbidities and even cognitive impairment, and typically that is going to be a major reason for why they may need a lot of long-term care services. Okay. All right. So here is the level care continuum of long-term care services. So let's start from the very beginning. First, we got like the most basic level of care, okay, will be the personal care level. Okay, so this is basic activities of daily living assistance. Okay, this is just your basic, like a caregiver will come over for however long and just help you bathe and feed you and things like that, right? well, not necessarily like feed you, but like maybe make you a hot meal and help you with counting money or any kind of chores that you have to do around the house. This is your basic care. Okay. Next we have custodial care, which is still caregiver level care, or CNA even level care. So it's just a little step higher than personal care. This type of care is really there to help this patient maintain what function that they still have. So the caregiver might try to, help them get up and walk them steadily over to like their wheelchair, or maybe try to do activities with them to help them maintain their function, and of course taking care of them and doing things like bathing and all that kind of stuff, and making sure that they take medication and doing things like that. That would be custodial care. So that's a step higher, a little bit of a step higher than personal care, just very basic stuff. Custodial care would be more instrumental activities of daily living. And then next up we have restorative care. Okay, so restorative care, this is more like rehab level care. Okay, so I forgot to also tell you that these both these are not going to be covered by Medicare. Medicare will not cover this stuff because Medicare will only cover things that are like medical related and like rehab related. Typically Medicare only cares if you need a professional, like you need a licensed professional to take care of you. Okay, so Medicare will not cover those. I hope that makes sense. So now we have restorative care, and yes, Medicare will cover these. Okay, because Medicare covers rehab stuff. Okay, so if you're at the restorative care level, of course you're going to need a licensed professional, and they are there to help regain or improve your function and give you professional level therapy. Okay, then we have nursing, skilled nursing facility type care. Okay, this is definitely going to be covered by Medicare, of course, because it's medical related. You're going to need nurses taking care of you 24/7, and then everything is going to have, your care is going to have to be under the direction of a physician. So you have to have licensed professionals taking care of you at this point. Okay, then next level is subacute care. So this is like post-acute type care. This is like after you've had like some episodic trauma or a major injury or anything like that, and you need, so you're taking a step down and you're in like the recovery level. Okay, post-acute care. And you still may need somewhat complex care, but you're still in that recovery level. Medicare is definitely going to cover this because this is medicine related. Okay, you're obviously going to have a physician and nurses working on you. Okay, so home and community-based services. So how are a lot of these things financed? Okay, a lot of the home and community-based services are financed by private and public. So we got public financing. All right, Older Americans Act is definitely going to be public financing. These are federal funds that the federal government gives to the states. Okay, and the states can allocate these funds to different community or home-based services for the older Americans. Okay, now, all right. Let's go. Okay. Anyway, Medicaid is also another huge payer, and a lot of these services, especially those that are on like the personal care level services, Medicaid will actually cover a lot of that. Okay. So we also have block grants that stem from our Social Security, okay, that will be used to cover a lot of the community-based long-term care services. Okay, so different types of community-based long-term care services. These are some different types of services that you can get in your community. Okay, so first, home health care. Home health care, usually this is going to come from like a hospital-based agency, home health care-based agency, a home health care agency, or maybe like a community-based agency, but it's usually going to come from an agency. And what they're going to do is they're going to send you your nurse or another type of like a CNA or caregiver or whatever to go provide you with whatever medical services you require or whatever long-term care services you require. Okay, most of these services definitely have to be approved by a physician because these are usually going to be medically related services. Most common type of services that will be provided during this, for home health will be like infusions and a lot of those type of medications. So usually you're going to get an actual licensed professional nurse coming and they're going to give you skilled nursing care. All right, so Medicare and Medicaid are both going to be financiers of this type of care, okay, because it is medically related. It's medicine that is being provided. So Medicare is actually it's probably the single largest payer here because this is mostly for those who are going to be disabled, for those who require, for those who are disabled, and then those who are 65 and older. So almost everyone who receives home health care is probably going to be a Medicare beneficiary, and so Medicare is the single largest payer for those who require home health. And then Medicaid is definitely going to be the second. Okay. Then we have adult daycare. This is where this provides some partial respite care to families. So families are kind of drained, burnt out, or they have other things that they have to do. Maybe they can allow their parents or grandparents or whatever to be taken care of at adult daycare. So this can be provided by, or this is where you can sort of drop your grandparents or your parents or whoever that you're taking care of. You can drop them off at an adult daycare center. Okay, there are many across the country, and then allow them to be entertained, socialize. And then many adult daycare centers actually like to focus on preventative health strategies and health maintenance and therapy in these places, and even rehab. Okay, so for that reason, Medicare can sometimes finance some of this, but most of it is going to be financed by Medicaid, private sources, and things like that. And then we have adult foster care. Adult foster care is for those who, instead of maybe living, for those who do require, someone to live with them, they can't really live with by themselves. This is for those who prefer to live in like a family environment. Okay, so instead of living by yourself or in another type of home like that, you can opt to live in a family environment and like maybe small community-based dwellings or anything like that. And so you would be able to get room and board and supervision from the family. You get to hang out with the family and things like that. And this is typically going to be paid for by Medicaid or private insurance, private sources, charitable donations and things like that. And also Medicare will pay for certain things that are medical or rehab related. Okay, so it's not going to pay for the adult foster care itself, but if there is like medical stuff or rehab that is being provided for the patient, then Medicare will cover that. Okay, so then we have senior centers, a lot like adult daycare centers. These are going to be local community centers, and a lot of what happens at the senior centers is just socializing, okay? Allowing those older adults to get together, socialize, talk about stuff, and it can be very therapeutic and make friends and all that. And one of the cool things about this is that they usually get free food, okay? Typically at adult or senior centers, they will offer one or more free like hot meals, which is great because many older adults actually are malnourished. They don't get as much nutrition as they should, as they need, because it's hard for them to actually cook. Okay, so this is going to be financed by a lot of public funding. The Older Americans Act, also Medicaid will help out with this. There's United Way, there's a lot of charitable donations and things like that. So there are a lot of ways that this is actually financed, and it kind of varies all over, but they typically have this kind of thing going all over the place, all over the country. Okay. All right, so then we have home delivered and congregate meals. So like I said in the previous slide, many older adults have a malnutrition issue, okay, because it's really difficult for them to just make themselves a good hearty meal, because they have to stand up and they have to chop vegetables and they have to do things like that. And it's as you get older, you lose a lot of function, and it's really difficult. I mean, many people have arthritis and things like that, so it's going to be really hard for them if they're living by themselves to make themselves healthy meals. So this is a nutrition program for older adults. Okay, typically you will get one hot meal every day for 5 days per week. And this is for those who are age 60 and older and their spouses. And usually it's going to be volunteers who are out there, passing around the meals and, making the deliveries. Or so they can do home deliveries, or they have them brought to like senior centers and other congregate settings for older adults. And how this is financed is going to be through the Older Americans Act, a lot of block grants that the government provides, and of course private donations and things like that. Homemaker Services. This is just what it is. So this is another home and community-based long-term care service where you can get like a caregiver or a homemaker type person to come to your home and help you with any kind of errands or any type of chores or anything that you need going on in your home. Okay. And how this is paid for is going to be through Medicaid and block grants and the Older Americans Act. It's also paid for by any kind of charitable donations and private funds. So really, I mean, if you are a wealthy older adult, you can also pay with cash. All right, so then we have continuing care at home. So this is kind of a newer model. And it's modeled after like those fancy retirement homes, except they want to give you, basically the whole idea or the concept behind this is that they want to give you like all the different services and all the perks of living in like a fancy retirement center, but giving them all to you in your home. Okay, so this is where it typically it would include a lot of care coordination, home maintenance, health chores, and making your meals, giving you transportation, helping you socially, and providing you with other, fun programs and whatnot, and things like that. And to get into this program, there's going to be a, initial lump sum fee or like a down payment kind of a thing. And then after that, it's just like a monthly fee, okay, monthly membership. Of course, it's going to be expensive, but not as expensive as living in a private retirement community. Then we have case management. So what I need you to know about case management is that it's not the same as in managed care. So case management in long-term care is where they take, into consideration the ADLs and the IADLs and whatnot, and they'll look at you as a patient and they'll figure out exactly what your needs are. They're going to figure out exactly how you want to address your needs, and they're going to find out what services you qualify for, what you're eligible to receive, the type of financing you are eligible to get, and then they'll start making referrals and sending you, to get this service here, go sign up for that there, and things like that, and then they'll continuously reevaluate your needs. So it's like you go to an agent and you say, hey, help me with my stuff. These are all the things that are wrong with me and everything. They'll figure out exactly what you need, figure out exactly what you can afford and what funding you can qualify for, and then they will set you up with the type of services that you can get. Okay, so there are a couple of different types of case management models. What's important, I think, really good, what's pretty important is to look at the brokerage model. Okay, these guys are like freestanding agents. And so they don't necessarily work for a specific organization or a certain company or a certain structure or system or anything like that. They're like freestanding guys that can just take you on and figure out exactly what you may need. And they don't necessarily have to send you to certain companies. They can really figure out what you need, what you qualify, and where you should go. Okay, a lot of people who are Medicaid beneficiaries and things like that will go to just more of like a brokerage type of a case manager instead of someone who's part of like a managed care model or another type of model. Okay, so then let's look at the managed care model. So this is basically someone who works for a managed care organization. Okay, and some managed care organizations will have services that are long-term care services for their long-term care patients. So these services are going to be delivered through a social managed care plan. Okay, and all these services are received through the managed care organization. Okay, so basically this managed care or this case manager is going to figure out exactly what you need and direct you to wherever you need to go within the managed care organization. Okay, all right. Now let's look at residential and personal care facilities. So let's look at the different types of facilities that are available. This is going to be the institution-based care portion of this. All right, so we have a residential and personal care facilities. These are not going to be the kind of facility where you need any kind of nursing care or any type of professional care or any type of licensed type of care or anything like that. These are not going to be licensed facilities. Okay, these are going to be those type of facilities that provide you with maybe just helping you take your medication. They're going to provide you with personal and custodial level care, not anything high, nothing above that. So nothing restorative care or higher, which means they're not going to provide you with any type of nursing care, any type of medical services or anything like that. Okay, so a lot of these institutions will not really be taking, or they're not going to take Medicare or Medicaid or anything like that because medicine is not really being provided here. So usually what you need if you're going to go to a facility like this is you're going to either pay with your private insurance or your money or your Social Security, okay, or any other type of like government assistance that you do have. Okay, and then so the type of services that they would provide would be meals, laundry, housekeeping, any kind of recreational activities, and helping you bathe and things like that. Then we have assisted living facilities. So these are going to, of course, provide like personal and custodial care, yes, but they also provide your 24-hour supervision. Okay, they're always watching you, they're always taking care of you. They provide you with social services, they all provide you with recreational activities, and they will provide some nursing and rehabilitation services. And for that reason, Okay, all states will require every assisted living facility to be licensed. Okay, so they have to be licensed because they do provide some medical and rehabilitation services. Okay, so they do hit that restoration level of care and higher. All right. Then we have skilled nursing facilities. Of course, you're going to have to be registered or licensed to have a skilled nursing facility, and they're going to provide you with, high intensive nursing care around the clock, 24/7, and it's going to require a physician supervision as well. Okay, so definitely going to be licensed by the state, obviously, and if you want to, federal certification is going to be optional, but it is going to be required if you want to accept Medicare and Medicaid beneficiaries. So if you want to take on those patients, you have to be certified. Okay, if you're not going to be certified, then you're not allowed to accept those patients who pay with federal or state funding. So you won't be able to accept Medicare and Medicaid patients. And you can only accept your privately funded patients, which may benefit, that may be what you want, or it might not be what you want. Especially if you're trying to take care of older adults, you may want to, it may be necessary for you to get certified so that you can accept Medicare. Okay. All right. So, we kind of already went through a little bit of this, but you guys can go through that one on your own. Okay, so some ACA, some Affordable Care Act requirements, some new requirements that came out for nursing homes. The ACA does require that if you are a nursing home who is going to go out of business, then you have to provide a 60 days notice of your closure. Okay, you can't just go, oh no, we can't pay our bills, let's close down shop. Because you have patients that you have to care for. So you have to have a written notice for at least 60 days, and then you also have to provide a plan for relocating all of your residents. Okay, you can't just leave them alone, leave them hanging. You have to figure out exactly where they're going to go after this. Okay, so subacute care facilities, this pretty much has the exact same requirements and things like that of a skilled nursing facility in terms of certification and licensure and whatnot. Okay, so if you are going to accept your Medicare, Medicaid, you've got to be certified, and if you are going to just be open, you have to be licensed, because this, of course, is going to provide medicine, nursing care, and needs to be supervised by a physician. There are 3 different types of a subacute care facility. So there are long-term care hospitals, okay, and these are also certified as acute care hospitals. And then we have transitional care units within hospitals. Okay, so some hospitals, some really large hospitals, also have skilled nursing facility units within their hospitals. Okay, and then they'll have to have skilled nursing facility certification in order to do that. Okay, and then same thing with skilled nursing care homes. Okay, they also have to have that skilled nursing facility certification. Okay. We're going to move forward. And private long-term care insurance, you can get it. The longer you wait to purchase long-term care insurance, the more expensive it gets. So that's something that I would recommend thinking about doing in the near future. Okay, because the younger you are, the younger you start at getting this long-term care insurance, the less expensive it's going to be, and then it's really going to pay out in the end. Because when you later on, in your life, hopefully way down into it, if you do need some sort of long-term care services, this will pay for it. So that way you're not relying on whatever private insurance you have, which may not cover long-term care, and you wouldn't be relying on Medicare and Medicaid either. Okay, so I hope you guys enjoyed this. I'm glad I kept it barely under an hour, but If you have any questions, please comment or send me messages, and I'll try to answer them as soon as possible. And I will see you guys in the next lesson.